All right, Mike Karegeannes here again, TMJ, TMD specialist and physical therapist. My prior video, you heard me explain normal temporomandibular joint mechanics. Now I want to give you an example of those of you that might experience some popping or clicking coming from, in this particular instance, because this is how the model is set up, the left side of your temporomandibular joint. So again, you have to keep in mind, right? There are ligaments and capsular tissue and all these things that attach to the disc as well as to the condylar bone and the temporal bone of our skull. But for simplified explanation, what tends to happen over time, it could either be through wear and tear, maybe some kind of facial trauma, nail biting, any kind of repetitive parafunctional habit like nail biting, or possibly just clenching and grinding at night due to maybe sleep disordered breathing, additional stresses, things that are going on in our life, we can develop a disc that will migrate slightly forward, and it actually will become displaced forward. Now this model won't let me show this, but not only can the disc displace forward, so if this is your condylar head here, not only can the disc displace forward, but it can also displace sometimes medial to the inside or lateral to the outside. Sometimes that disc can completely perforate or split and go in both directions. So there's a variety of things that can actually occur in this joint. But I always like to say the most common patient that seeks treatment tends to be the one where they'll have an anteriorly displaced disc, or an anterior medial displaced disc would be the more common in the clinic anyway. So this would be a situation where the disc is slightly displaced forward. And when you go to open your mouth, you will hear and possibly feel a click in the joint. And then what happens is during that moment when you hear that click, the disc has relocated back into its proper position and orientation and protecting the joint. And then that will continue on usually through the full opening phase. Generally, yes, there can be pain with this. Sometimes plenty of people have popping and clicking joints that will pop and click the rest of their life and never progress to a problem. But if you do experience pain and things like this, then this is something we would want to help you treat and help resolve. And then what we find is upon closure, just before closure, the disc will sublux anterior again and be off the condyle. And we will have what's called sort of an anterior disc displacement with reduction. And the condylar head, based on position, will slightly be more posterior or to the back of the joint and superior, elevate inside the joint. So again, when you, with this disc slightly displaced, when you go to open, you can hear a click, and then you will continue to open fairly normal, and then just upon closure, you will hear a closing click, and the disc will sublux forward again. Generally, the opening click is much louder and maybe more abrupt than the closing click. But in order to be classified as a true disc displacement with reduction, you need to have a closing and an opening click. A lot of times if we can't hear it, we will listen with a stethoscope over your ear on both sides, and that will help us pick up sounds as well. Sometimes just gently light palpation, you can feel the vibration through the bone. And of course, if you really want to be technical, you could always order an MRI, a closed and open view, to get further confirmation of this. But let's face it, with healthcare costs and things like that, that's not always practical or a reality. So that's an explanation of a disc displacement with reduction in the temporomandibular joint. Thank you.